Well, back with Dr. Pittaway. Dr. Pittaway, we talked about people having missing teeth. Sometimes, in the back, 1, 2, or 3, and quite often for a while, because apparently nothing bad is happening. And yet every dentist, like you, keeps saying that you got to replace them. And when there's lots of missing teeth, give us the structure of what's happening in a short way, and also give us what's happening to the rest of the body, because how your missing teeth support and keep the body aligned. I mean, how the normal teeth keep the body aligned, and how the missing teeth throw the body out of alignment.
Well, that's an interesting question. Some studies have shown that if you have a proper bite, that you're stronger and that you perform better. Obviously, having missing teeth also affects your appearance. It affects how you eat and chew your food, and it creates an unstable situation for the teeth in the mouth, because they're used to having teeth to chew against and teeth on either side. And when you start losing teeth, they can change position. It can affect the bite. It can create jaw problems. It makes it harder to clean certain areas. You can have more decay. All sorts of things kind of begin. It can be almost like a domino effect as your mouth starts to fall apart. Let's say you put in a partial denture and hook it on the last tooth. That puts strain on that tooth. Next thing you know, you lost another tooth or it breaks. So missing teeth are a big handicap. It's definitely nice to replace them, and it's also important to realize that your health is affected by what goes on in your mouth.
Right. So let me. I come from an engineering background, dealing and wheeling with cogwheels and hinges and stuff like that. So I noticed that when there is one cogwheel which isn't working for whatever reason or is out of place, it throws the rest of it out. It's almost like, that's where the thing come throw a monkey wrench in it, It literally works like that. Now, let's take a fence with lots of, fence poles, and 1 or 2 start missing, and next thing you know is they're playing like a piano. They look ugly, and of course they become unsafe. You can't sit on it anymore. With a tooth, that would mean you can't bite on it, because if a tooth is straight, you can put weight on it. When a tooth is crooked and you put weight on it, it goes eventually. Just like with a fence pole. Sit on a crooked fence pole, and a little tiny, 50-pound kid will break that same ball. And let me ask you, so those teeth start getting crooked like in a fence pole, they probably operate like, from an engineering viewpoint, like a crowbar. So are they pushing the next tooth around, and then that's how they all get moving? And if they do that, can they go all the way to front so that even your front teeth become ugly like a rabbit or something? Yes?
Well, a lot of things do happen. You're right about the forces on the teeth and how it affects. They can move and shift. That can create problems with your smile. If you go back in history, the most stable architectural form is the arch. The Roman arches, they're still standing. Now,
right.
If you pull one stone out, the whole thing crumbles down. And our teeth are arranged in an arch. And as soon as you lose one of the stones or one of the, teeth, you've just destroyed the integrity of that structure. And now you have to adapt. And it's really just kind of a matter of time before things start to collapse, shift, and cause problems. So,
right. Well, your knowledge of I gotta interrupt. Your knowledge of the arch is really wonderful. I've never heard that, but that makes an awful lot of sense. And in a smaller way, it's like you have 2 hinges, a door hinge, and one gets used all the time because it's all crooked. Well, that hinge will eventually break. And so let me ask you, so when that happens, after all, you have hinges here, right? And, for the 2 jars, and so this thing starts not working, and you maybe start looking a little ugly again. I have a problem with looking ugly because of teeth. I mean, it just doesn't make no sense to me. But Also, wouldn't that kind of pull your shoulder pain and your neck pain and maybe even make headaches because it's all wacko? I mean, if your legs, one leg is too long or too short, or one leg is crooked for whatever damn reason, the whole body needs to adjust, and quite often you have back pain and headaches only because your foot is out of alignment. Wouldn't it go the other way around too? If this is out of alignment, wouldn't you also get back pain and neck pain and headaches?
Well, absolutely, that's possible. I mean, there's a lot of pain created when you get out of balance. One of the things that I always try to achieve when we're rebuilding missing teeth is getting the harmony of the muscles and the joints back so that the body works properly, because, you know, the energy flows through the whole body. It gets out of whack up there in the mouth. You can have jaw pain. It can turn into headaches that can be debilitating. You can have problems extending down into your neck and your shoulders, and that's shown by quite a bit of research.
Right. So let me ask you. Let's say a person has headache, shoulder pain, or, you know, kind of this type of pain, and he did do his fair going to a chiropractor, going to an MD, he did his couple years of Tylenol, and things are not quite working. And he might or might not have a lots of missing teeth, or he might have had missing teeth and they were replaced. Would it be still wise for him to go to a good dentist or to a couple good dentists, you know, a second, third, fourth opinion type of thing, really find something to kind of see whether there is something wrong with the alignment of the teeth? I guess you guys call that having a bad bite, having an out of alignment bite, and to maybe fix it or at least eliminate it and say, no, it's not that either. Would that be a wise action to do?
Well, absolutely, Helmut. I have lots of people who come to see me. They've been to their doctor with pain in their ear or some other symptoms, and that's not the problem. I had a lady a couple of weeks ago who was taking antibiotics for an ear infection. She didn't have an ear infection. She had a problem with her jaw joint, and we made her plans to balance out her muscles and relax all the tension in her face, because her muscles were in conflict because she didn't have a stable position or a home for her teeth to fit together. And so it created constant tension in her muscles. It created horrible headaches. We're taking pain medication on a daily basis. I see this all the time. I can create an appliance to diagnose and figure out where the jaw should be in harmony with the muscles and the bite, and the pain frequently just vanishes. The patients are so grateful. It's really great to be able to have somebody come in and get them comfortable after they've suffered so much and not even knowing what was wrong with them. And
right.
So
right.
I love being able to fix those headaches.
Yeah, and you know, so because those things like the headaches with this cause your teeth are missing, or you know, just like your teeth are missing and your face starts getting deformed because your bones start shrinking and you start looking ugly, or like with the gum disease and you're getting all kinds of like a weak immune system. I mean, those things are literally more devastating to people and slowing them down economically and with relationships, because who wants to have a good romantic relationship when you have a headache? You know, I mean, who wants to go and who is able to have a really, you know, powerful career and is always up to beat, which we have to be in this type of world. If we're not, we're dying. If you have again a headache or a neck pain and you couldn't sleep, and it, you know, again, well, all those things could possibly make you know, robbing of sleep, which in itself is one of number one reason people go insane. I mean, by insane, they don't necessarily start seeing ghosts, but they start getting, you know, well, cranky at the very least, and that's insane. So it's quite amazing what a dentist could possibly fix. It's not that all those things always will happen because of dentistry. We know that. We're not trying to get that across here, but we do try to get across here that you should check those things out, because they could, and in many cases are, the problem.
Well, absolutely, Helmut. There's a huge impact on the quality of life when people are suffering chronic pain. And I find so frequently that we can get rid of that pain and they can get their life back. I mean, you're right. If people are in pain, they're grouchy. They can't perform well. They don't sleep.
They can sleep well, which we know that's a big problem. You know, sleeping is just so important.
Yeah.
Good. Well, again, I hope this video was useful to people watching, and I hope they start realizing that, you know, maybe the problem doesn't come from where the problem seems to be being. You know, it's not just because you get old so you have a caved-in face. It's because you're losing your bones, you have a caved-in face. It's not that you're weak because, you know, and tired because of whatever genetic type of things. It could be, but it could also be that you have a mouth infection going on for years, and it is weakening you. It's eating away at you. And you could have headache and back pains simply because your jaws are out of alignment, and that's just all there is to it. Let's go and get it fixed. Thanks a lot, sir. This is very informative, Dr. Pittaway. Thank you very much.
You're welcome.